But in other news, let's talk about, oh shit, the election got me all distracted. But wait, we still have COVID? The US is breaking records for the number of cases reporting today. Again, over 150,000 new cases in one day. And scarily enough, the number of people hospitalized is going up, which completely debunks Trump's theory that cases were rising because they were doing more testing. It's really bad over there. And of course, what happens in the US always happens in Mexico. And things are not going well here either. I feel like Mexico City is playing that game, that your mom played when she wanted you to come to her. Be like, Johnny, come here. Johnny, now. 1, 2, 2.25. Johnny, 2.5, 2 and 3. Johnny, you're not that stupid. I'm not going to say 3. And this is what's been going on in Mexico City, where things are getting worse, but another shutdown would be catastrophic for the economy. So last week, the Mexican government announced orange light, but now with alert, right? That drastic measure being put in place to contain the virus by basically closing down restaurants at 10 instead of 11, only 6 people at a table instead of 10, and only events of 25 or less, hopefully enough in scaring people into just wearing your damn mask. And Mexico City Governor Claudia Sheinbaum has been threatening today. She said there's a possibility that we're going to go back to Semáforo Rojo, basically threatening to see if people are going to do what they're supposed to do. But just wear your damn mask. And sorry, Charlie, wearing it under your nose is just like not wearing one at all. It's like wanting to have sex and the only thing you have is queso Oaxaca. Good idea? Not good enough. Today, Mexico said that we're very close to the red semáforo, but for more on what is going on in Mexico City, we are so grateful and lucky to have Dr. Francisco Moreno, Chief of Internal Medicine from the Division of Infectious Diseases at the ABC Medical Center. Dr. Moreno, thank you so much for joining us. I know how difficult things are right now, and I'm sure you're super exhausted, but we're really grateful to have you on the show with us today. Thanks so much for joining us.
No, thank you. It's a pleasure to be with you. And I was hearing you saying about the election in the States. It's important that people realize that the pandemic, the management of the pandemic has something to do with the results of the election. And I hope people here in Mexico heard about this because they are not doing their jobs and they are going to have an election next year. The Congress is going to change. And I think it's a very strong message. If you don't manage the pandemic, voters are going to go against you because they're having people, family that are dying, and it's a very sad moment for our country.
Yes, absolutely. And let's talk a little bit more about that. What's really important for you to share with us is that, there's a lot of rhetoric going around in the last couple of months that this is the disease for the rich people, and then it was transferred to the poor people, and then different groups of people are not being affected by it. But now, as cases go up in Mexico, is just COVID everywhere, or is it hitting specific communities much harder than others?
Well, I think it's clearly that this is a disease that affects everybody, affects rich people, people that are not economical, wealthy. But the problem is in Mexico that the health system has been hit very hard. It was not a very strong health system. We had our problems since the beginning. So I think that the strategy was to try to prevent cases, not try to treat the difficult cases that I know, and you know that these cases are going to be very difficult to manage in any part of the world. So the success for this pandemic is to control and prevent cases. But that's something that needs to be done wearing a mask.
Just wearing the damn mask, right? I mean, that's pretty simple about that. Mexico has not mandated masks before. Do you think a mask mandate can work here with our culture?
Well, I think that if we start seeing the president wearing a mask, it will be great. I think that the Ministry of Health in Mexico is not wearing a mask. So the message has not been going through everybody. I think that it's around 60% of people using a mask. That is the most easy preventive measure that we can do to prevent and to avoid the spreading of the virus as is happening right now.
Right. Now you work at the ABC Hospital, one of the most prestigious hospitals in the country, with arguably some of the most best resources. What is the difference between what's happening in the ABC Hospital as compared to a general hospital in Mexico?
Well, if you look to the numbers in Mexico, unfortunately, only a very small percentage of the people have access to private medicine. But in our hospital, our death mortality for patients that are admitted with COVID disease is about 3.9%. The percentage of the death rate in public hospitals is around 35, and in the IMSS, that is the most common public service, is 43%. So it's 10 times more than what's happening in the private hospital. And that's because they don't have the machines, the people, that the specialists, the critical medical doctors, infectious diseases doctors, pulmonologists, what you need to treat this disease.
So you're saying that 10 times more likely to die in a general hospital than in some of the hospitals like the one that you work at. That's astonishing, doctor. Are things getting worse here? Are we at a critical stage? Is this the worst that you've seen it in this entire pandemic?
Yes, and I think it's getting worse because we are getting to winter. And you know that in winter, the mortality from respiratory diseases, usually without COVID, increases 5 times. And now you're going to have flu, you're going to have another viral respiratory diseases that are going to be very difficult to differentiate from COVID. So what we look to the future is a very difficult times. Hospitals are not able to have patients in different areas very easily. In many hospitals, patients share rooms with other patients. So imagine if this is something that you don't know if the patient has flu or COVID. We're going to start having a lot of transmission of COVID in the general hospitals with other patients with other diseases.
Right. So in your patients, where are you seeing the outbreaks happen? Like, where are your patients going? Is it in large celebrations? Is it in group settings and game nights? What's going on?
Yes, I think that after we have been in COVID closing and opening and everything for 8 months now in September, some parties happen because we have the Independence Day and weddings start to happen. And the people start having weddings of 400 people that were in the room, the wedding room. And after 3 tequilas, they take out the mask. And we had 70 patients coming from one wedding that were infected. And without masks, the viral load is more high. So people get sicker, and you have complications even with younger people.
So you said 70 patients that you had coming from one wedding. Was this wedding in Mexico City? This is astonishing.
In Mexico City.
Wow, 70 patients from one wedding went to your hospital. That is absolutely astonishing. So it seems like people are letting their guards down and getting tired of this, but it's not time to do so. No? Are we going to Semáforo Rojo? Are we going to go to red light? Are we going to close again?
Well, I don't know, because that depends in many facts. Remember, the semáforo is depending on the bed's ability. But if you look to what the ratio of mortality in public hospitals, this is not a matter of beds. This is a matter of how many new cases are you having in Mexico. And unfortunately, we also do not do tests. So we don't know what the real numbers are. This is getting very complicated. And hopefully the people start wearing masks, start seeing that from that wedding in which you had 400 people invited, you had 70 that got sick from that. Well, start changing your minds, because if you don't change your way of doing things, this is going to get worse and worse.
Right. So it seems like there's a lot of apathy among young people and also middle-aged people, because the majority of the people have a headache, they get sick, or they feel a stomach ache for a couple of days and then they recover. And so it seems like a lot of people are willing to take the risk because they feel like that nothing is going to happen to them. Some nightclubs are open, a lot of bars are open. Why should someone, a young person, not think that way and take care of it, especially coming from you and seeing all of the things that you've seen in the hospital?
You know, this is a matter of taking risk, and if you are unfortunate to have some weakness in your immune system that you don't know, or the viral load that you receive because you don't wear a mask, and the people that were around you were having a high viral load in their systems. You, even being a young, normal adult, you can get very sick and you can die. So if you want to take chances, it's taking the chances of you dying, but also it's taking the chances of you getting the disease, bringing that home, having your dad sick or your grandpa or someone in your family. And really, you need to realize that you are being the reason for that patient to die, or for that family to be in the hospital for some time. So it's a matter of your conscience, and making the real conscious that you can transmit the disease to someone that is not as lucky as you are.
Absolutely. We have about 1 minute left, and this is really scary, but give us some hope. Pfizer announced on Monday that their vaccine is 90% effective, and it seemed to give a little bit of a good breath in the world. Biden's election, there's been some good news. They're hoping that this isn't going to go for too much longer. Can you give us some hope or some positivity for something that you're looking forward to with this virus?
Yes, I agree with you. I think that the message is clear. We are going to have a solution for this in the next months, probably 6, 7, 8 months, but we're going to have a solution for this. This is not going to be forever. So now is the time to act and prevent, and that you stay alive, and that you keep your people around you alive, doing preventive measures. If you do that, you're going to have a normal life in 8 months. But if you try to do whatever you need to do now and avoid the measures that you need, maybe you're not going to be able to have that in 8 months, the enjoy to be around your family, because some members of your family are going to be lost. So think about today. You're going to have a hope in the future. There's going to be some solution in the future. I'm sure about that. But right now, it depends on us.
Right. Absolutely. Dr. Moreno, I just want to say on behalf of our viewers, and I know you're doing God's work, you're doing amazing things over there. And we really appreciate you taking the time to be with us today, and our best to all of the frontline workers in your hospital, and also all the hospitals all over the country. I know you all have taken a huge hit. The mortality rate of doctors, and nurses, especially in the general hospitals with little equipment, has been really high. And so I know that a lot of people are thinking about you, and also the other workers. And I think we need to take care, not just for us, but for you as well. And I really appreciate you being on the show, and hoping for some good news soon, and hoping this thing ends quicker rather than later. Thank you so much for joining us on the show.
Thank you, Dan, and be careful, everybody. Try to be safe. It's time to take care of ourselves and our people around us.
Okay, Dr. Francisco Moreno, head of infectious diseases at the ABC Medical Center here in Mexico City. Thank you so much for joining us.